A very good morning and welcome back to Morning at NTV, the number one breakfast show in the country that is geared towards acquainting you with that number one information that you need to conquer your day, conquer your weeks, vis-a-vis conquer your careers. In my hand, I do have Inspire Africa coffee. If you just take a sip of this coffee, you can resuscitate your creative processes, so do not make a mistake by kickstarting your day minus taking a sip on this very scrumptious Inspire Africa coffee. Well, that aside, I do have a conversation largely centering around current affairs, what is happening into the country, cases of nepotism, cases of insecurity, cases of health workers missing out on their allowances in the wake of a pandemic when we should be rolling out too much money for them to actually go ahead and do their work without any problems. We had extended our invitation to the ICT and National Guidance Minister Chris Bariomosi to come here and make sense of these issues, but up to now the minister is a no-show. But we shall continue with this conversation with Sarah Bireete, the Executive Director for the Center for Constitutional Governance. Well, Sarah, welcome and thank you for joining us on Morning at NTV.
Yeah, thank you and good morning, viewers.
Indeed. Whenever we call on to civil society, whenever we call on to members of the opposition, they're actually prompt. They actually come here very fast. When it comes to government leaders, when it comes to the technocrats working with government, they actually leapfrog their way to the studio, or when it comes to diverging information that goes a long way in helping Ugandans in that regard. So before you call NTV opposition, before you call Morning at NTV, the opposition, you should know that we did extend these invitations to these members of the government, but they actually turn us down or do not make it to these conversations. That's why when you largely see one voice coming in from maybe the opposition or civil society, you might think we are the opposition, but we are not. This is largely an independent news organization. This is largely a non-partisan news platform in that regard. Let's continue with Sarah Bireete and expound more on what is happening in the country. Honorable, that is the Prime Minister Nabbanja, she actually recruited 5 of her close relatives, Sarah Bireete. 2 of them are her biological daughters. We are talking about Nakasumba Fatina. She is a Minute Secretary in the office of the government, of the leader of government business. And we also have Nakasumba Farida, that is a senior liaison officer in this same office of the leader of government business. Taiwa, the chief whip, also employed 4 of his close relatives. Are we normalizing nepotism within this country?
Yeah, but you see, the NRM government is headed by the president, who is also a party chairman. Doesn't he recruit his relatives? His wife is a member of his cabinet. All right. His children are a member of his staff, both in the forces and his office at State House. So I think that's what sets the pace for the ministers. If the president can work with his wife and children, I mean, why can't the prime minister also work with her children? So I think that's where the analysis should start from. What is the practice in the NRM government, and how do they treat family? Of course, they will tell you the family qualifies. But is that sectarianism? Don't other people qualify? Are these jobs advertised? You know, what is the procedure? But I think the Right Honorable Prime Minister and the Chief Whip, you know, also, like Chebe said, that when a mother cow is chewing grass, the young ones are watching. I think they are simply following the footsteps of their boss. Yeah.
Don't you think this nepotism taking center stage affects service delivery within our country?
But which service delivery? You know,
there is no service delivery in this country, Sarah?
No, it is, but you know, when you look at conversations, you look at the most contentious sector now in the easing of lockdown is the education sector. But so are discussions formal? Are they pillow talk? Are they, so that's why some of these things get complicated by the top, who is a fountain of honor himself. Yeah. So I think really to blame junior people is maybe they are also victims of the system. There is also growing impunity, growing mutual suspicion. People suspect each other, too much talk
I hear you when you say mutual suspicion, because most of these people that were left out of office for the last 15 years, they were working in this parliament. But then they were working with Mbabazi. Many of these people, they were also working with Ruhakana Rugunda. Do you think maybe the Prime Minister and also the government chief whip wanted to remove those people who are working with their predecessors? You're talking about Mbabazi and Ruhakana Rugunda.
Yes, you know, infighting and mutual suspicion cannot allow professionalism to prevail. So some of these, some people have worked in these positions for 15 years, the policy analysts. That is enough experience for such office holders. But when you come in office and you have this mentality of saying, I must get away with the so and so people. Even in NRM, there is talk of my people, their people. So you don't know where these people belong. And that creates suspicion. But also the safety of people working in these big offices. There is too much talk about their health. People are told not to eat anything. People are told to walk with their mineral water in their cars. So I think all that environment that is too toxic, plus the practice of their boss, has led to this kind of situation that we are seeing today. So they are victims of their own system.
Now, we have a group of people who have been working tooth and nail during this COVID-19 pandemic to ensure that they advance the best of the social services, health social services in that regard, the health workers. But they've been grappling with meager resources in that regard. Imagine working during a pandemic, you do not have an allowance in that regard. The health workers within Kitgum, another jurisdiction that has recorded some 458 cases of COVID-19 since May, have no protective gear, have no allowance to help them go ahead with their activities in that regard. Sarah Bireete, is it rational to have this conversation come about in the middle of a heinous pandemic? Allowances for health workers.
You know, it is very embarrassing on us as a people, as a nation, and I hope Parliament works to rectify this situation, because complaints have been coming in since last year of unpaid hardship allowances, unpaid overtime allowances for people working, you know, to prevent the pandemic. And then, of course, coupled with all the misuse of funds. And I wish you had invited the permanent secretary, Madam Diana, because she's the accounting officer for the health sector. These complaints have been here for now 2 years.
I have a number, I'll call after this show.
Of unpaid health workers.
Go ahead.
Parliament approves money right from last year in April. For the health workers, for more recruitment, for more services, and the lack of protective, you know, personal protective gear, of course, exposes them to the pandemic. We've lost up to around 80 nurses since the pandemic started. Nurses are the first health caregivers for every patient. And then you have them exposed, and we are not looking at their protection, but we are praised for containing the pandemic. So I don't know why we have such gaps for our frontliners. It is very embarrassing.
But that would go a long way in actually, we can surmise and say that government did not learn anything from this pandemic, because many people had hoped during the onset or onslaught of this pandemic that maybe we would see more money going to the health sector, more money, even the education sector. But still, the health sector is grappling. Does that mean government didn't learn a single lesson during this pandemic?
Are they interested in learning? You know, many people look at COVID as a money-making venture.
Yeah.
And that is demonstrated.
Money-making venture.
Yes, that's demonstrated through the lack of accountability in the first phase.
Yes.
Many people jumped on looked at COVID pandemic as an opportunity to make money. People who took contracts to bring oxygen, bring personal protective gears, there is zero delivery.
Those implementing SOPs?
Yes, according to, you know, the money that was meant for the security, you saw how most of that money was abused. The grant for education, 60% has gone into administration. You know, to push back against the effects of COVID pandemic and enable the less fortunate people to access learning away from school. And then you budget that 60% is administrative cost. I mean, really, what? It is money heist for these people. It is not about people's health and well-being.
It's not about people's health and well-being. A money-making venture. Is that what we are seeing at the airport right now when they actually, government took over the testing of people arriving, travelers arriving into the country? I mean, from $65 to all the way $35, 105,000 Uganda shillings. If you are in Kenya and you want to come to Uganda, you've been vaccinated in Kenya, you are negative, you've been tested in Kenya, you are negative, then you make it your way to Uganda, you are still required to undergo more PCR tests. Now, this is the need. People coming in from Kenya will test negative from their country, but when they make it to Uganda, somehow the results come out positive, and they are saying it's a money-making venture whereby they make too much money from these positive cases.
Well, I've seen the outcry of tour operators
90%
on how they are,
cancellations.
yes, how they are losing business. I have gone through this testing twice at the airport. It's surprising why, you know, like in Kenya, if you have a PCR test within 72 hours, you don't test on arrival. I've been going through the testing requirements, the COVID requirements for most of African countries. Once you have a negative PCR test, they only test those who have symptoms similar to COVID patients in other countries. India does testing on arrival for all passengers, but they use the antigen tests, which are rapid. Immediately you get your results. So, and it is free. It is a cost, you know, covered by their government. Other people don't test. So, as much as we say we are doing better than these countries in terms of managing COVID, I have seen comparisons between, you know, Uganda and Kenya on managing COVID. Kenya, every sector is open in Kenya, including the entertainment industry.
And schools too.
Yes, schools have been, you know, operation, I think, most of this year in Kenya. And all schools, including nursery school children.
Indeed.
So when you have a sector that is open 100%, curfew starts at 10 p.m., people are able to move and go on with their lives, I think there is a slight difference of infections between Kenya and Uganda. But our sector is, I think, half closed. Curfew starting at 7 a.m. We all lose about 4 hours in traffic trying to get back home. So we work like half day or 3/4 of what we are supposed to be doing. So we have these challenges. You know, another surprising thing I saw in Kenya, they do not have PCR test results that you can get in 4 hours. The minimum you can get is about 20 hours.
I see.
So what kind of technology are we using?
So meaning there could be fake results?
No, I don't know, because I'm not a scientist.
Because you are going to test negative in your country, you come to Uganda and all of a sudden you're positive.
I'm not, a scientist, but I was shocked that you cannot get a 4 or 6 hour test result in Kenya.
It might not be
the
accurate.
Minimum is 20 hours for a PCR.
Indeed.
The only rapid test you can get is an antigen test. So I was like, what kind of technology are we using in Uganda? Maybe we are more advanced than Kenya, which has never been the case before in terms of medical technology. I don't really know what it is. Secondly, I don't know. Maybe somebody from Ministry of Health should tell us the data from airport testing. What is the positivity rate that warrants this draconian measure that is not seen in any other country? Other countries that are doing airport testing are testing people who have shown symptoms on arrival, or they are using antigen tests. But for us, we are using PCR, mandatory for everybody, vaccinated and unvaccinated. I mean, what is it that over this time they've been testing at the airport? What are the findings? What is the kind of crisis and the positivity rate for travelers that warrants this draconian measure at the airport? But on the most concerns of the tour operators is the shabby manner in which the exercise is conducted. It is really extremely frustrating.
Experts might agree with you when you say it is a money-minting venture, because you did have 6 private laboratories that were offering this COVID-19 testing that was stopped and government took over. Seems like they were looking at the money that these private labs were making at the airport.
Yeah, I know. So government has proposed to bring down the cost by half. So of course that indicates the money-making aspect. If you say we shall test at 50% of what you were charging, so what was the purpose of the other 50%? It was extreme profit. But when you look at the manner in which the procedures of testing at the airport, first there were those red listed countries. So if you know that these are passengers that have come from Kenya, South Africa, these were part of the red listed countries, why don't you say that passengers from Kenya, South Africa, take this route? But the manner and the caliber of people at the airport, you can only cry for your country. I don't know where they were got from, the manner in which they conduct themselves in that exercise of who is eligible for testing and who is not. Yet the countries are listed, and as you travel to them, you know that I will test on arrival if I'm not fully vaccinated. That was the previous arrangement. The current arrangement, vaccinated or not, you must test. It even defeats the saying that we are vaccinating to build herd immunity. And even in Europe, where people who are vaccinated are free to go about their business, fully vaccinated. But in our case, even to travel, you are fully vaccinated, you must test. I don't know what kind of science is driving that decision, but I'm sure the scientists have better answers.
In a nutshell, should we scrap these fees or requirement?
Other countries who are doing mandatory testing are covering the costs, because the passenger has already covered the costs of testing before they board the airline, which are mandatory and in all countries. So you subject somebody, actually you do test before you go where you are going, test before you depart where you had gone, in the case of Ugandans. So then you have to do 3 tests. One is a PCR test before you go, PCR test before you board the plane to come back, and a PCR test on arrival. Most people travel for 2-3 days, working days. And I have tested, picked my results, driven to the airport. Everybody on the plane at the airport is tested, vaccinated, and you wonder what risks are involved that would mandate this draconian measure.
Of course, you use Kenya as an example. Kenya is grappling with 244,000 plus cases of COVID-19. Uganda is grappling with 122,212. That is more than double of the cases within Kenya. But then Kenya has had its schools reopened.
Every economy is open.
Yes.
Every economy is
learners are still having an education. In Rwanda, they did the same thing. Learners went back to school. Tanzania did the same thing. Learners are in their institutions getting an education. Based on that analogy that our neighbors are largely open, when it comes to the schools reopening, do you think we should have opened schools as soon as yesterday?
I know the time schools were reopened, there were mistakes, 3-fold mistakes. One was on the part of the schools, concealing COVID cases.
Yes.
And of course, maybe some of them were congested.
They were.
Yes. So they did not have enough first aid or medical preparation in these schools, for the children that would get infected. 2 was, of course, opening without vaccination of the adults or eligible categories. Yet I saw teachers were listed among the first people to get vaccination in this country, with journalists and other frontliners.
But so far we've only inoculated or vaccinated 200,000 plus teachers.
Yes, that's negligence on the part of teachers.
88,000
because I know, I think for media, I think about 80% are fully vaccinated by now. Because the teachers were in that first priority of people to be vaccinated. I don't know why they never went for vaccination. The third kind of negligence was lack of surveillance, both on the district health and education teams. So we need to have, if we are to open, in my view really, we need to have, make sure there are facilities in these schools to offer first aid with antigen tests for students who might get COVID. then they can do confirmatory tests through PCR. 2 is vaccination. I am really against people who are hesitant on vaccination. Yet we all know how Europe and other countries have managed to reopen their countries fully and get back their normal lives through building herd immunity. The third aspect is constant surveillance, functional surveillance by district health teams and district education teams of what is happening in the schools. But the fourth aspect should be phased opening. Let's have 1 year going back to school. If it is senior 3 who need to go to senior 4, you call them 1 or 2 months, let them finish, promote them, they go back, call another year. So if you have 1 year at a time at school, that provides enough space for the required social distancing to prevent massive spread of COVID in schools. So really the continued closure of schools is lack of leadership in this country.
Lack of leadership in the country. You do have the First Lady, Janet Museveni, who also doubles as the Education Minister, who says the decision to close down schools was meant to protect the livelihoods of our young people, the lives of our young people.
But how many people are we losing in the closed schools? We are losing generations. We risk losing generations. I have seen a report of double teenage pregnancy. People who got pregnant in the first lockdown and have now conceived again. So somebody has 2 kids. Will they return back to school?
All right.
We are losing generations in this prolonged closure of schools. So you prevent lives, you lose generations. But also we need to look at other statistics that have shown that draconian measures of lockdown, the report by World Bank that for every life saved, we lost 4 lives. So how do we account for that as a country?
Sarah Bireete is the Executive Director for the Centre for Constitution and Governance. Sarah Olanya, the Speaker of Parliament, says he will not be debating any of the old bills that were passed by the 10th Parliament. That is a conversation I would largely want you to actually give us your 2 cents on when I return, because many Ugandans were hoping these bills would change their lives. Let's take a breather. We'll return shortly with Sarah Bireete. Welcome back, and many thanks for staying with us right here on Morning at NTV. I do have my comrade Ivan Walanyolo, who is ready to acquaint us with an update. A very good morning, Ivan. What's the latest where you are?
And our audience, I am coming to you from Entebbe. But while we know from the Ministry of Health's decision last week to take over the screening, the mandatory screening of all travelers that are coming into the country, of course, there was no clear indication apart from the preliminary information we had that the Ministry of Health has issued an ultimatum up to 23rd of this month, which is a Wednesday, for the private companies, the 6 of them that were undertaking this exercise, to have, winded up and it officially takes over. But from that time again, nothing so serious, nothing much has been done apart from the indoor meetings that the Ministry of Health, the Prime Minister and the Civil Aviation Authority were of course engaged in to see and also look at ways where is the exercise going to be undertaken, because the initial information I had is that the Ministry of Health wants to remove these services from where they were being undertaken at the Panial Beach, next to Lido Beach, back at the airport. But remember, this is not the first time that this exercise has been planned or had been planned to be taken at Entebbe International Airport. If you can remember last time, the exercise, actually the facility was set up at the tarmac, and when the World Food Organization tents, the big ones, were installed at the airport, but from an inspection point of view from World Health Organization, they found it prudent that these facilities that had been taken were not convenient for the Ministry of Health to use in screening these people. There was no aeration, among other things that were required out of them. That's when you saw it going to the hands of the private health facilities. But this time, if it's being brought back at the airport, the modalities also to think about is where is it going to be put at the airport. Because when you are talking about mandatory screening of the travelers at the airport, you are talking about over 2,000 passengers going and coming. But because they will only be handling the ones who are flying into the country, over 1,000 of them. And remember, when these people's samples are picked, they have to wait for a time. They have to keep around and wait for their their, results will be back, unlike the tourists whose samples will be picked and proceed to their destinations and results will find them on their way. But these people will have to keep around and wait for their results. So where are you going to keep them? Do we have enough of this space where these people are going to be kept, or we'll see them, just move around the airport, loiter, and perhaps we see more other, spread of the COVID-19. But also modalities being discussed, we know is that what is the capacity? Is the Minister of Health going to, require a lot of space at the airport? And the only space I have heard from the sources is that they are targeting the new passenger terminal building, which has just been at the airport, to be used as the screening center. But that remains a subject of discussion, especially from Civil Aviation and the Minister of Health. The latest meeting that was on, of course, it was yesterday, when the Prime Minister, Right Honorable Nabbanja, was also part, but still the modalities discussed were not concluded. So it remains a subject of discussion and a question when the Minister of Health will come out to say this is the day when we are officially taking over this service. But far away from that, the private health facilities are currently still undertaking the exercise up to when the Minister of Health will, of course, take it over. But you, of course, will remember from the recent, when there was chaos at the airport, over 100 passengers missed out on their flights due to delayed COVID-19 test results from one of the laboratories here. So we wait to see when the Minister of Health will communicate officially. But as of now, not even anywhere at the airport has been decided upon when this screening exercise, of course, will be undertaken. Ramya Usiku, that's what I can tell you for now.
Very much, Evan Molonyolo. Grab yourself a cup of Inspire Africa coffee this opportune Monday morning. A very good morning once again, Sarah Bireete. We were talking about Jacob Oulanyah saying 10th Parliament business won't be debated in the 11th Parliament unless it is reintroduced. What does that mean? What does this mean for the country? Before I let you go.
Well, the 10th Parliament agenda had bills that were not signed by the President. I saw the Right Honourable Speaker using Article 91 of the Constitution as a basis for his decision. But Article 91 of the Constitution has three elements. One is the period through which within which the President should assent to the bill once presented to him, and it's 30 days. So within 30 days, if he wants to return the bill to Parliament, he should do so and explain, give his reasons for returning the bill. And once that bill is passed in the same manner, if Parliament does not agree with his reasons, and it is passed again and sent to the President for his signature, he either signs or it automatically, becomes law. I think there are bills that fall in this category, first of all. And bills are being returned to Parliament outside the gazetted period within the Constitution, outside 30 days. You see a bill that it has returned after 4 months, so I don't understand. There is no observance of time as provided for within which a bill should be returned to Parliament. But for the bills that were passed by the 10th Parliament, I think Honorable Jacob Oulanyah is out of order, because those were passed, debated, passed, adopted by the body that is supposed to make laws in this country.
The Speaker of Parliament, Jacob Oulanyah, is out of order
to reintroduce bills that were passed.
Thank you very much, Sarah Bireete, the ED for the Center for Constitutional Governance. At this opportune moment, let's go to Stephen Mbide. Stephen Mbide is on standby to give us the latest information as far as Yona Luanga is concerned. A very good morning, Mbide. What's the latest where you are?